Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us.
Today I have with me Dr. Scott Cordova, and he joined the oncology team at CARTI and their world-class radiation team. He specializes in gynecological malignancies with an emphasis in high-dose rate brachytherapy. Dr. Cordova, thank you for joining us.
Thanks for having me. I appreciate it.
So tell us about your work and what is brachytherapy?
Well, so I'm a traditionally trained radiation oncologist, which means I use radiation to treat patients with cancer all over the body. But at CARTI, I focus my work predominantly on gynecologic malignancies, cervical cancer, endometrial cancer, and vaginal cancers. And in particular, I focus on brachytherapy, which is a way of allowing us to give high-dose radiation right next to the tumor and give very, very high doses to cure a lot of times gynecologic cancers.
And so brachytherapy is not new, right? Is it your method of how you're doing it a little bit different?
So you're right. Brachytherapy isn't new. In fact, it's been around for probably about a century or more now. And it's well established in the treatment of a number of cancers, gynecologic being probably the foremost. But there have been some significant changes in recent years, and that's part of what I'm trying to do here at CARTI in our program.
And there has been some stigmas with this type of therapy as well, and you're trying to kind of overcome those, or you want the public to and healthcare providers to know that those stigmas really aren't true?
Yes. So it's considered more of a procedural subspecialty within radiation oncology. And a lot of times we have to do some things that are more surgical in nature. But I hope that people understand that they are minimally invasive or even non-invasive types of techniques. And we focus very strongly on patient comfort as well. So we're doing the very best we can to ensure that we can deliver these very important life-saving treatments in a manner that is comfortable and palatable to everybody that comes to see us.
And so what do you want gynecologists, PCPs, physicians that are seeing patients that might need your service? What do you want them to know before they refer to you?
Well, one, I want them to know that we're always available to see patients that have even a suspicion for gynecologic malignancies. And I work very closely with gynecologic oncologists, medical oncologists, surgeons on a daily basis. So if you send to us, you're not just sending to me, you're sending to our tumor board, essentially. And we manage these patients in a multimodal, multidisciplinary type of method. I would also like them to know that, brachytherapy is a very important part of curing cancers, particularly cervical cancer, as well as we can now use it in other cancers that previously had not been utilized as frequently. So, for example, medically inoperable endometrial cancer is one that is radiation's kind of been relegated to more of a palliative type approach. However, with advances in brachytherapy, we can now administer definitive type doses that would allow us to curatively treat some of these patients that just couldn't safely undergo a hysterectomy, which is the standard of care currently.
So what is new in Arkansas for this type of therapy? This is very specific. It's not happening everywhere, right?
Yeah, so I don't know exactly what's happening everywhere. However, one of the things that I'm practicing and have instituted here at CARTI, which I know is new to our center, is MR-guided adaptive brachytherapy for cervical cancer. Those studies have only been out for the last few years, so I suspect that it's relatively new in the state as a whole as well. The other thing that's new is that we're, again, offering treatment for medically inoperable endometrial cancers, which hasn't been available previously. And importantly so, because endometrial cancers are becoming more and more frequent, and the death from endometrial cancer is actually increasing over the past few years. So I think it's a very opportune time to be able to bring this to the ladies here in Arkansas.
So, Dr. Cordova, I appreciate you talking about this important work that you're doing. And before we go, what is the message that you're wanting the healthcare community, our audience, to know about your work, and what should healthcare providers know about it?
So I want them to know that brachytherapy is still a really important part of treatment for patients with gynecologic cancers. It's not just surgery, not just chemotherapy. It's really a multi-pronged approach nowadays. And we can have really major impacts on survival and quality of life for patients now. And I want to make sure that they're aware that these services are available. They don't have to go to a major academic center or go out of state. They can come to Little Rock and see us and get the same type of care that they would be able to get elsewhere.
Okay. Well, Dr. Cordova, thanks for joining us today. I appreciate it.
Certainly. Thanks for having me.
And that's it for this episode of AFMC TV. Have a great day. Thanks for watching.